Okay, so let's start. Morning, everybody, and thank you very much for joining us again for one of Bon's seminars. We've been running lots of these recently in response to the COVID crisis on all sorts of topics. This one we're running with MzN International, a not-for-profit B Corp that we've got a really good partnership with, and we're delighted to be working with them on the second seminar in this series. Just to say, we are recording this session, so it will be available later. If you have questions, so the way it's going to work is we're going to have some presentations, and after that, a question and answer session. So if you do have questions, type them into the chat box. We'll relay them to the panelists. And the panelists today are Christian and Joseph, both from MzN, and today we'll be looking at financial scenario planning in uncertain times. So I'm going to hand you over to them and ready to kick off. Thank you.
Thanks, Michael. Really appreciate it. Good morning, everybody. I hope you are well in your living rooms and hopefully not the kitchens. And we are off and to talk about financial scenario planning. Introductions first. My name is Chris. For all my sins, I'm unfortunately running MzN International, which is a B Corp in the international development and humanitarian space, where we help, and our NGO clients and partners, philanthropists and governmental agencies with finances, strategy, organizational development. In short, trying to make our partners and clients better equipped to deal with uncertainties and shocks like that. I'm also a chartered accountant, and I'm German, so I'm especially boring, I'm afraid. Yeah, it was very hard to convince my wife to marry me. She's British. Having spent 10 years in a management consultancy at MzN Young, and then at the World Bank, and then the interim finance director for Save the Children. So, do you want to say a few words about yourselves?
Yeah, my name's Joe. I've been working with MzN for probably about 4 or 5 years now as a finance consultant. I work with the majority of our sort of clients and partners in looking at either financial systems in terms of how their organization run their finances, but also looking at a sort of broader range of funding and financial scenarios to sort of support their strategic decision making. My background is corporate finance. I spent 10 years at HSBC, and since then I've been working with MzN as a consultant, both for the European Commission and MzN, and I've very recently submitted my PhD thesis on also financial inclusion. So very much a finance person.
Okay. Since we're all on a lockdown, I thought as a mini icebreaker, we share our favorite lockdown activities. Mine still is, that is my son and my daughter. They're gardening with me. And for the first time, we've actually had time to plant trees in the garden. Isn't that amazing? I'm a terrible gardener. I'm sure they will die.
My sort of lockdown activity, which is actually something quite new for me, is cooking. I live overseas. I live in Bangladesh, so don't get a lot of time to spend in the kitchen. So this lockdown has sort of introduced me to the world of cooking, which is very nice.
Well, don't invite me anytime soon, mate. All right, we're off. We're here to talk about financial scenario planning, and a lot of you turned up to talk about this one. So here are the talking points that we will speak about. First of all, we'll address why we even do a plan. Everything is so uncertain. Isn't planning sort of pointless anyway? Then we are starting with a minimalist approach. How do I create a sort of good enough, quick and dirty financial scenario? And then we're increasing the quality. So we're saying, okay, what answers should my financial scenario give me at the very least? How should I even do it? We answer that as well. Then Joe will take you through an example, and we are then returning you that example to say, fine, we're done now, we have a financial scenario, now what? We've got about 15, 16 slides. We're trying to wrap this up in about 20 minutes to 20, 30 minutes, not speeding through it, but going at a decent pace, because the real added value is then the question and answers. As every content from MzN that we publish, this one is free to share. I think the slides, Lena Bond will circulate them around later. They include also our contact details. So any questions and thoughts, ideas, or merely just having a sound wall, play them back to us. We'll respond within a day or so. Usually, or at least one of our colleagues around the world will do that. Good, and we're off. So some of the questions that some of you have submitted before the session deals with the question, why even bother? One of the questions, I'd love to hear who it was, submitted the question, how to stay sane. And I think that is along the same lines there. I really like it. But not to be too boring, basically, we need to do financial scenario planning because of the uncertainty, because it effectively reduces and beats to a certain degree uncertainty. It reduces the risk. That's the most important part. It allows us to determine at least a range of possible futures, reducing the risk and maximizing its potential. It supports, therefore, decision-making. If you know you're running into a funding shortfall, that's not good. You need to know by how much in order to act upon it. It also presents us with opportunities, this lockdown. Let's not forget about that. So if we now know that we have an opportunity to implement differently, but we need to do certain investments, financial scenario planning lets us know how big our war chest is for that and how much opportunity costs we might be facing otherwise. Most importantly for me personally is it creates a baseline. I'm not sure about how you feel, but I do feel affected also emotionally by this one. And maybe it's because I'm an accountant, but these scenarios give me a certainty saying, okay, well, these are the likely scenarios, 1, 2, and 3. At least I know where I am. The future is always going to be between these scenarios, but at least it's not a complete free for all. And then lastly, it's worthwhile saying, given that we work in an inherently insecure world, and on top of that, we are all working in development and aid organizations, so an inherently insecure and fast-changing environment, it actually always helps. You know, this may be driven by the pandemic and the lockdown right now, but it's a good practice to do in any scenario. If things generally go fine, maybe we don't need to update the scenarios every month, or every 3 months we'll maybe do. But it is seriously good practice, like a financial hygiene practice, to look at the best, mid, and worst outcome on a routine basis. So who should be actually involved? First of all, I would really like to encourage everybody to include as many as possible. And I know we are busy, but here's the number of people that should be at least at a minimum involved. It should be the program managers, the relevant field staff, and yes, the finance function. Very important here, and I say this as the former FD at Save the Children, finance director there, it is important that finance doesn't end up making programmatic decisions. Just because we do create a financial forecast that will include how much certain programs are scaling down or scaling up sometimes, or staying stable, finance should never be in the position or forced to make these decisions and then allocate resources to that. That should definitely come from where the program is based and for those who are in charge. But that means they need to be included in the process. We're working across the organization, all parties, this goes a little bit into how to do it, should simply give their estimates to the broad scenarios. So for example, if you are saying we are looking at a 2, 4, 6 month lockdown scenario, or 3, 6, 9 month, just ask them in writing, how would that affect your program? I'm sure you've done this. Then let's remember that these scenarios will be locally unique. while some programs might be scaling back, others might be scaling up, actually. We have clients and partners at the moment who are actually upscaling the programs because they're in the health and medical sector. And Joe, I think you'll show a couple of examples of that later. But one thing that gets you to a formalized scenario is not just asking your colleagues, like I make in the second point here, about their estimates, what will happen to their program, but then inserting that information into a simple one logic and format for the entire organization. You might only have 1 or 2 country offices, you might have 15 country offices or 20. The financial consequences of what your people in charge are telling you about the programs should be inserted into a one logic. So if you ask them for 3, 6, and 9 months, they shouldn't reply with saying, well, for the next 3 weeks, I'm doing this one. For the next 4 weeks, I do that one. Try to unify that into a simple forecast scenario, an example of which we'll show later here. That one logic is very important. Otherwise, all the scenarios will be anecdotal at best. And just as a point of managing it, that in itself is a bit of a job. So you can appoint a scenario lead anywhere in the world, really. Doesn't have to be a finance person. The finances and the Excel spreadsheeting isn't actually that complicated. What's important is that the information needs to be translated into that template, just in terms of how to manage it. Good, moving on. One of the big things we want to mention straight at the top is that one of the key reasons we are doing financial scenario planning is that income, as we sometimes find out during this time, is very variable. Expenses are not. Now, what happens a lot is that expenses are behaving like you see here in this red graph. They're sort of a stepped process. Very few expenses are variable. Yes, you can maybe stop the delivery of large non-food items, or you can maybe stop the costs committing to a purchase you're trying to make, or maybe you can kick out that consultant within a relatively short amount of time. That may be few examples of variable costs, but most expenses are in the short term static. You need to do some significant steps in order to reduce them. You know, staff redundancies, rent cancellations, IT wind downs, other expenses. Considerable work has to go into these in order to reduce them. Income, however, unfortunately, a very different thing. It behaves more like the green one, or at least I hope it behaves like the green one. It goes up in the end again. That can crash or increase very suddenly. And this is probably my #1 reason why the scenario planning is so important. It enables us to forecast the financial impact of this reduced income under different scenarios. It also tells us how much of a cost step down do we need to make. If you see my mouse cursor, I'm not sure, do you see my mouse cursor? Yeah, no, thanks, Joseph. That is the portion here that is now to be covered by reserves. If our reserves cannot cover that, then we need to step much more aggressively or seek other help. Good. Now, let's have a look at the income at the green graph first. Now, we all are implementing or advocacy-based INGLs or NGLs, and we work on programs, and then we assign a certain part of that as an unrestricted part to either the non-funded part or the HQ. So that's the difference between restricted and unrestricted income. I'm sure I don't need to tell you, I'm sure you know that. Now, over the last few weeks, as you can imagine, my colleagues around the world and I have been very busy and in never-ending Zoom details helping our clients do financial scenarios and create cash flows and donor communications that get the most out of our funded work, our donor-funded work. One of the key solutions or key points that I've made over the last 4 weeks or so is make sure that when you speak to donors, you suggest a solution and not just present questions. Donors who we work with a lot as well have reported back to me, including last night, saying, you know, some of the INGO partners and NGO partners are presenting us with a problem. That's fine, but we have 15 or 20 of them in my inbox. I'm more likely to just agree to whatever they are suggesting if the methodology is based on some reasonable scenario. And I think that's just human, frankly, because they are overwhelmed as well. Now, obviously, we want to be program specific. Donors see their programs as programs, and then with us being the implementing partners. We, as a finance person, as a leader of your organization, you might see more your entire organization. So we need to get these two viewpoints agreed. And when we speak to the donors, we need to be program specific, and we must let the individual programs do as much as they can to update their forecast monthly. So let's not inspire a lockdown through the scenario planning. We've had that problem as well, that some people in country offices thought, HQ is doing a scenario planning, so I must now prepare a lockdown. No, that's not communication. Let's be clear, be program specific. Dear program manager, what can you do in your program? And some of them will scale up, some of them will move to digital, some of them will just hibernate, some of them will experience a serious reduction in implementation. And then, as I said before, create this single financial model. Now, when projecting this all, and I can't believe I have to say this in 2020, but let's use a financial model that suits your organization. We still are seeing many organizations that are effectively using the donor reporting template to manage their own finances, or at least have that in agreement. That, unfortunately, will never really suit your information needs. You're never going to get a good scenario, or indeed any other financial information out of that. So please, this needn't be a big finance software. This could be excellent. But create a model that actually suits you. Now, what we need to understand here as well, and we'll talk about that later, is how the cost recovery will impact our HQ or our unrestricted budget. That's very essential. I'll get back to that in a minute. And very important, as I said before, but it's worthwhile repeating, let's use the same models at the program offices for any HQ income generating activities. So if you have an income generating activities, great. Let's put that in there as well in the scenario. Your fundraising on philanthropic might, for example, go up. Right. Oops, I'm sorry. There we are. Finally, quick myth busting, hopefully, on the cost reductions. Cost reductions are not always good. There are two types of cost reductions in our sector. We can reduce the cost from the restricted funding, and we can reduce the costs from the unrestricted. Now let's just stick with the unrestricted first. That's easy. If we are funding an activity or an expense from unrestricted funds, either ICR, then yes, that overall reduces your cost. So that increases your surplus. Great, no problem in thinking there. However, we've had conversations over the last 4 or 5 weeks with our clients where it revealed that the same logic, they don't fully understood or didn't fully appreciate in the heat of the moment, that the same logic doesn't apply to restricted funding. I hope you all think that is just absolutely fine, but if we are reducing our implementation, if we're reducing the cost from restricted funds, that means we are drawing less on the approved grant. That delays the implementation, or even if the donor is not as flexible, makes it later eligible for recovery. That also reduces the ICR income, the internal cost recovery. Your internal cost recovery, or your unrestricted portion of 7% DFID, but other percentages, other donors, depending on the NICRA rate in the US, depends on the expenditure of restricted income. So cost reductions in restricted funding reduces or delays the unrestricted income. In the short term, it actually increases your deficit. I hope I made that clear. If not, we can talk about that later as well. Right, that's my 4 or 5 slides. Joe, do you want to take us through an example?
Yeah, absolutely. Great. Thanks, Chris. I think it's, summarizing what Chris has said, this is really about designing something that's whilst organizationally applicable, it's also takes into account the sort of intricacies of each program. And I thought it'd be best to work through an example. I've changed all the numbers so it doesn't really reflect a client, but it is based on a kind of conversation and a process and a plan that I've worked through with a client. So the client is multi-country implementing partner for many agencies, has about 10 countries and between 1 and 4 programs within each country. It has a headquarters of which is largely funded, or certainly over 50% funded, by cost recovered through grant spending. So in building the scenario, first of all, at a organizational level, we built or conceived of three scenarios, which were effectively a time frame from, I believe this one was 2, 4, and 6 months, but we've also worked with 3, 6, and 9 months. We then go out to the country managers and the program managers and discuss with them their individual programs, their individual countries. A lot of the context is very different. I imagine if you're running a program in Sweden, not that you would be, you probably don't have any impact at all. And in some countries where you've got really full lockdown, you've probably got a huge amount of impact. But what we started seeing were working with program managers. You've got, and I think there's a good split in examples here. We've got programs 1 and 2, which whilst they see some reduction in scenario 1, it's around 10% for program 1 and 0% for program 2. They are very much reflective. Program 1, incidentally, is a medical program, a clinic, a non-COVID clinic that has a supply of protective equipment. And the donor, the country, and the program manager and the country manager all were insistent and have been able to keep running that program as budgeted. And in fact, are actually at the moment that's looking like it will increase. Program 1 is seeing a sort of steady reduction. It has a quite a large digital element, which has also been able to continue. When we started talking to the program manager of programs 3 and 4, they had a huge face-to-face or a significant face-to-face training aspect, which meant that even in scenario 1, we're looking at a drop of somewhere in the region of 15 to 20%, and in the worst case, well over 35% drop in expenditure. Now, lots of these from a country perspective, their costs associated with implementation were incredibly flexible. And I think what was failed to be recognized by certain parts of management, that the actual knock-on effect of a decreased programmatic spend is I use the term ICR here, but what I mean is costs that are recovered from grant spending that go into funding their sort of head office support network. And what we saw was, over those 3 scenarios, a reduction between sort of $90,000 and $230,000 that was flowing into a very fixed cost base in the headquarters. So I think the main sort of takeaway was that whilst our conversation with management were quite often along the lines of, oh, the donors are being very supportive and they're giving us a no cost extension and they're moving these things around, that there wasn't the full appreciation that whilst the ultimate budget may be spent, it might not be spent in this financial year, depending on how the scenario plays out. And that will have a very serious knock-on effect on their ability to fund their headquarters in that financial year. So I think if I move on to the next slide, Chris, I think you wanted to talk through those points before I move on.
I think that's a really, really good point there. Bear in mind that these expenses are staying fairly static and the income can be delayed. So just to reiterate what Joseph just said, that's absolutely fine. So to get back to avoid that, here's a step-by-step guide to do it. You set out a template. It can be as simple as the one we just showed you. If you need a template, reach out, we'll send you one, although the template needs to be specific to your organization. but it's not rocket science really. My tip then would be focus on income first. So ask your colleagues how much of the grants can reasonably be implemented. What is the impact on fundraising, on the unrestricted? I don't mean funding, I mean fundraising. And what can we agree with the donors? Third is, of course, delay or reduce variable expenses. Not to the point, however, that you start hurting your operational core. If any of you signed into the webinar last week, Strategy in Uncertain Times, then we talked about that. If anybody is questioning what expenses to delay, again, we can send those notes from last week. Forecast your big expenditure, establish when these can be reduced. Your expenditure, as we said now thrice, is fixed or relatively fixed in the short term and becomes a bit more flexible in the long term. And ultimately, you can then use those two information to put into a financial model to forecast the impact in any of the above scenarios on your own budget. And how that works, Joe takes us to the next example.
Great, thanks, Chris. This is following on actually from the same organization that was before. Once we'd gone out to each country office and collated all the information with the sort of head of programs and finance, we then had a total budget of 29,000, of which 29 million rather, of which 3 million was costs to be recovered for headquarters. So headquarters was relying on $3 million of funding generated through programmatic spend. We now went through the scenarios and looked at what difference those scenarios, those very, very sort of granular level changes of which each country office, each program manager was able to really go through line by line and make sure their scenario was reflective of their reality, meant that in scenario one, which incidentally we prepared this probably 6 weeks ago, and scenario one was a 2-month is sort of extension, of which means that scenario one is probably now looking more like budget, and the scenarios play out differently. So we see in scenario one, $320,000 of that 3 million, so about 10%, would not be coming to head office. That going all the way down to 40% of head office's sort of expected funding from programmatic spend would actually be missing in that year. Now that would create a huge gap in funding on what is largely a fixed cost headquarters. Chris, if we go on to the next slide now, effectively, and this was not an uncommon conversation with certain sort of headquarter management individuals, that there hadn't been that full appreciation of what slowdowns in programmatic spend meant for their fixed costs, or rather their revenue. In fact, what we notice is that the reduction in expenditures in programs has a significantly greater effect and risk on the kind of core structure of the organization than it does on perhaps the programmatic part, which is designed very much more flexibly to move with the grant spending. So we noticed, and again, I've changed all the figures, but this was a very, very close to reality of what was going on. They expected a revenue of about 5.5 million, and that's for head office, their support function, all of their kind of core activities, of which they had an expenditure of budgeted of about 5.2 million, giving them a surplus of $300,000. Now, over those scenarios, what they realized was, whilst they could cut the budgeted expenditure, some of them were able to use Geneva Canton or US government, UK government schemes to furlough staff, or to gain sort of funding elsewhere. So they were able to cut their overheads, but not at the rate that met with the reduction in revenues over that period. So eventually, in the sort of, let's say, the worst case scenario, which as an organization we developed with them, which at this point in time probably is only meaning September this year. So this is not planned out to the point of, of unrealistic expectations, we were seeing from a surplus of about $300,000, which would have gone into their reserve. They probably have a call on their institutional reserves to some degree if things don't change back very quickly. So in the worst case, we see actually a $300,000 deficit on 2020, and that's based on the reducing cost recoveries that were done in the last that were presented in the last table, and equated against their ability to reduce their head office budgeted expenditure. So, they were actually able to take actions, which meant they were probably about $800,000, $800,000 better off than they could have been, based on the fact that they could flex their HQ expenditure somewhat. But still, it meant a very different position than they'd expected at the beginning of the year. Now, if we move on to the next slide, please, Chris. The big challenge, I think, that was presented in between finance and the sort of perhaps strategic management tiers that take a sort of operational overview, was all of those things, all of those charts, all of those numbers. We have multiple variances on multiple spreadsheets, are all very good if you are financially literate or even able to sort of read financial numbers. But I think where we saw in the communication part the realization come in as to what actually this outcome that they perhaps hadn't anticipated was when the situation was visualized. So, very simple, taking those numbers and visualizing them in a way. I've taken two very simple examples, but you can of course overlay various different things there to identify what the situation might be. Those kind of, particularly that surplus deficit graph, turned what was quite a gray sort of spreadsheet into something that people saw a decreasing line and sort of a fall below zero. And suddenly it became, particularly from the finance team, they realized that they were able to gain the attention of those sort of strategic managers to get the sort of level of realization that, actually we do need to start thinking strategically about our costs and about our ability to flex in this situation. Otherwise, we could be presented with a situation vastly different from that we expected.
Yes.
I think that's probably me done with that. So I'll pass back to Chris to round off before we move on to questions.
Thanks, Joe. Really appreciate it. Good. So we've seen how visualization helps and how a relatively sort of 20% reduction on implementation leads to a 200% flip in the unrestricted. So this exponential effect is definitely there, and visualization helps us process that. Right, final 2 points, and then we move to questions. Once we've done that scenario, it worth remember, this is all just a scenario. This is all there to design and to facilitate decision making. So to preempt the possible question is, I wouldn't design more than 3 or 4 scenarios. We have seen clients who design 7 or 8 scenarios, and at this point, the strategic decision making is hindered more than helped by it. If you're using a sort of extreme point in scenario planning, that doesn't help either. So I would go for a worst or medium to best case scenario, leave it to that, but not make the worst and the best case the extreme points, a total shutdown for 5 years. This is not going to happen. Using the latest budget, therefore, that you have, whichever you have, the budget for 2020 as a baseline really helps as well. It doesn't matter that may be 2-3 months out of date. I wouldn't bother with updating that before you go to scenario completion. You can do a scenario based on that baseline on a quick and dirty manner within a day, within half a day. and then become increasingly iteratively more accurate. I think that's what we've done as well with some of our clients, just to provide an early range of futures. So the range of possible outcomes starts very wide and then just starts narrowing, and that would improve decision making. And then finally, when you illustrate your financial position under the various scenarios, these are the 5 areas down here that will help you. I will focus on illustration. So yes, illustrate by using graphs and pie charts and all kinds of other illustrations, your costs and revenues, cost potential, the impact of cost reductions. Watch those impact on cost reduction that come from restricted income, because they have the adverse effect, as mentioned before. Very important is visualize the impact on your reserves, because your reserves are obviously important, and we cannot trade or continue the operation if there is no ongoing hope for those reserves to be reestablished. Bear in mind, particular for CEOs and the management suite, that you have a duty of care here, and there is a thing called wrongful trading here. Now that has criminal implications then. And now let's not forget as well that the pandemic does provide us with certain opportunities, as all crises provide us certain opportunities. The opportunity for digitalization, for spreading out, going more agile on the head office would be just 2 standard runs you might have heard before. We can also gear up certain parts of our program. So you can think more strategically to see what programs are really struggling right now and what programs are more or less resilient or even have experienced a positive impact on the scenario. Those are the programs that in the medium to long term we may want to invest or focus on more, because clearly this will not be the last crisis. This scenario planning, once this crisis is over, or once we are thinking about gear up again, will also help us in the future plans from a more strategic level, more longer term level. If we are thinking about your organization now, in 4 years' time, it'd be helpful to look at what programs did well under this lockdown, did well under this, or were at least less affected by this pandemic. And those are the kind of programs we may want to invest more in on the future. Communicating it then, that's my very last point. Now I'm German and I'm an accountant, as you heard twice now, so I tend to write very long reports. Joe just took a sabbatical and finished his PhD, so he wrote huge books on, so we are maybe not the best authority for writing short reports, but short is better. If a report is longer than 3, 4, 5 pages on financial scenarios, does that really serve the purpose? I don't think it does. However, in this short amount of time, short amount of space, be clear with the assumptions. You will have to make certain assumptions. For example, foreign exchange rates, reserves. Your reserves might not be held in cash. If your reserves are held in an investment, you need to make an assumption on how that is performing. And you need to create a space for discussion and planning. The assumptions can be changed, in which case you can change your model, and hopefully your reserves at the end of it will look like that. Good. Thank you very much. Now it's over to you with any questions.
Brilliant. Thanks very much, Chris and Joseph. We've got some interesting questions coming in. First one I'm going to ask is from Nicholas Rayno from BBC Media Action. Can you talk a bit more about the options for cost-based reduction? What savings can realistically be achieved within 12 months?
Sure. Nick, nice to hear from you again. Just to clarify the question, I mean, there's 2 types of cost savings you can make. You can decrease your variable and your fixed cost. Your fixed costs like employment contracts, rent, certain subscriptions, things that they will not change over the next 2 or 3 months if you start them now. They are fixed in the short term. Your variable costs you can do immediately. Those are your office travel expenses. They will have reduced massively. immediately. Those are some of your insurances, maybe if they're not tied to a long contract, you can tweak them monthly. They may be your consultants or your externals that are on a shorter notice period. These you can cut down. Now, as an NGO, DBC Media Action, you're an NGO. You need to also ask yourself, with what funds are we funding these expenses from? So it is no good, and I want to be very clear, it is no good to cut a cost that is funded by restricted funding. That has the adverse effect because you cannot draw on the related unrestricted to that. So even though you may be a variable cost, so say that consultant or say that online subscription or the travel, if you can still spend that money, do it.
Okay. I've got a question from Ronald Cansere, I think, from International Alert. What general trends have you seen from donors? This is your crystal ball question, both of you. Do you anticipate an increase or reduction in ODA? And also with donor countries choosing to fund home activities before overseas activities? That's very much yes, have a go at answering that one.
Okay. Michael, you were breaking up there a little bit, but as I mentioned, I was in a big conversation with the Gates Foundation last night. They are behaving, and I think when I spoke to DFID or the German GIZ here, Joe, you spoke to quite a few as well, and program managers, maybe you can contribute to that as well. When I spoke to the foundations, the interesting point was that those philanthropists are about to step up. And that's really, really encouraging, very interesting. They're making a lot of noise on the West Coast, so East Coast US, as well as here in Berlin, and many of our philanthropists partners in the UK, where they say, look, we cannot be in a post-COVID world where we lose 20 or 30% of the charities. That will not help us get through the next crisis that will certainly come. Besides, many say there is no post-COVID world, there will be only a with-COVID world. On the institutional governmental donors, they are obviously tied into a much more regulated, law-abiding structure. However, they are quite flexible, at least here in Brussels and in Berlin. They're reasonably flexible when it comes to no-cost extensions or even realigning programs, moving funding from one program to the next. Let's bear in mind, the last thing these donors want is to get the money back. That gives them a problem. They need to spend the money. They've gone through the expense and the effort of donating it and making the grants available. They do not want that back. So this goes back to my, Ronald, my earlier point. If you have two programs with the same donor, it's a good idea to say, can we, and one program can continue implementing, the other one is more effective. Can you move some of it? I think, Joe, you had an example there, didn't you, recently?
Yeah, I mean, I guess the larger question as to where aid flows are going to go is a very crystal ball question. But what in sort of dealing with country level donor representatives and the program managers and the country managers, what we notice an amazing sort of willingness to be flexible. And as was part of the point in the presentation, the flexibility wasn't necessarily driven by them. It was sort of best case proposals put forward by ourselves and our partners to sort of say, well, you fund two programs, one of which is very medically centric and is able to continue and actually could grow. And one of them is a livelihoods training program, of which we've had to sort of almost tail off 50%. You know, is there some way that we can reassign or reapportion funds? And as long as the proposal was well structured and well detailed and sort of met their kind of overall criteria, they were being incredibly flexible and actually even looking to increase the funding to that particular program greater than that could come from the additional program. So I think we're seeing like great sort of efforts, flexibility, resilience to try and make particularly those things that are ongoing and of kind of critical importance, of which, you know, the majority of people's work is, you know, to make things work.
Yeah. And we're planning a webinar at the moment about funding in the with COVID world that looks particular at those very recent, not even yet published, new COVID-19 funding, as well as the philanthropic step up here. We haven't got a date for that one yet, but I'm sure that will be communicated soon.
Okay, I've got a question here, which is a number of people have focused on this. But this one is from Pin Collicott from Development Initiatives. It's, what approach would you suggest around building scenarios around the changes in your fundraising pipeline, which 6 weeks ago may have looked optimistic, but are now looking uncertain? I mean, certainly in the research that Bond has done, uncertainty about the funding pipeline is being felt all over the sector. So how would you manage that uncertainty about that funding pipeline?
It's a good question, and we've also seen a lot of uncertainty with our partners. The first impact we've had was obviously a sort of even worse delay in the awards. Even if you are, so wherever you are in the funding process, wherever you are with the grant proposals, we've seen a massive delay. Maybe you've seen something else. I'd be interested to hear that. We've also seen that certain donors are gearing up. So there are donors, as I said, the corporate and the philanthropic donors that are faster to react. I'm sure in a month or 2 months' time, the governmental donors will gear up. And we have literally had calls with certain donors where it says, look, as long as it says COVID-19 on there, we're basically going to pre-approve it. That is very nice. However, we still have to make sure that we can actually do the work there. And then lastly, Michael, you and I and Bond and MzN have been saying, and I know the sector is debating it at length for 10 years, that we need to diversify our funding base. Running a 90%, 80% on grants wasn't ever sustainable. If this crisis doesn't push everybody to say, right, okay, let's really become a true NGO, a true civic organization, which is not overly and unjustly influenced and dependent upon governmental funding, then this crisis certainly is one not to waste and finally get that initiative off to a good start.
Thanks, Chris. So here's a couple of related questions from Gabenga Coker from Safer World and from Fiona Gregg from Link Community Development International, which is really about how do you decide when to dip into reserves against the balancing that against cutting fixed costs, particularly staffing, and you know, how do you, if a donor, if you've got fixed costs like salaries in program delivery and donors don't pick this up, what you know, something like that can sink a charity with small reserves. So what's your approach to cutting fixed costs like staff and salaries?
Joe, you're currently going with one of our clients through a cost-cutting exercise. I'd love to have your input here, but just to say one thing only. If your scenario, if you can delay the death of your organization with your very short reserves by cutting costs, then that's what you need to do. There's always the option to not do that. The Brussels ECHO has given a press release quite clearly saying, look, we can't save every charity. Some charities will go bust. Then I would say, let's plan an orderly wind down. That's also a scenario that is very possible, certainly up there. Not that anybody of us want that, but that is possible. If your reserves allow you to stay in business for 6 months, then I would be careful with cutting costs that will not be replaceable within another 6 months. So if you have key staff that you have to let go right now, would you really be able to get that key staff back in 12 months' time? It'll take 3-4 months for that salary cost to drop anyway. But if that really hurts you, in mid-21, then that may not be the best option to cut. And then lastly, you may need to make some investments. If your reserves allow, you may need to now invest into the diversification of your funding pipeline, because COVID isn't the last crisis we'll have. We have more shocks, particularly in the UK, in fact, coming up next year. They're already knocking on the door. So I would say if you can allocate some funding towards diversifying your income stream, then if you haven't done it already, now's the time to do so.
I mean, I don't really have a great deal to add to that. I think Chris covered everything incredibly well. If you've got reserves and, you know, and not all organizations are in that position, then from the organizations that I've worked with in this, particularly to do with this crisis, it comes down to a multitude of things. And, you know, there's a lot of kind of either, let's say, organizational culture or family feeling that actually whilst, you know, there's a healthy amount of reserves, and they should preserve the organization in the best case it can, and cover as many salaries that aren't being covered by donors, or as many people that can't be furloughed or covered by any other kind of funding mechanism. And then there are some that really just don't have the financial standing to make those decisions, and systematically they have to work through the most sort of variable cost that they can minimize. So, you know, from an HR perspective, those people that are on short-term contracts or in probation periods, and I mean, these are people's lives that we're talking about, and I appreciate that, but sometimes to protect the sort of bigger thing, those decisions are being made, you know, quite systematically, and looking at, okay, where is our ability to reduce those costs in with the sort of least organizational impact, like Chris said, don't, you know, axing key staff with a long notice period to then realize that you need to re-employ them in 2 months after their notice period run out is a bad decision. But, you know, there are decisions that are much more flexible and much more variable that should be made first before you need to go into that scenario of spending reserves.
Yeah, one. I mean, freshly analysed data. Our most recent survey of the impacts of financial impacts of COVID on our members, we've had 116 responses from our latest survey. That's 26% of our membership. 10% of our members have already made redundancies. You know, that's within 5 weeks, and many are waiting really for the furlough. The furlough is just kind of preserving some jobs for the furlough period, and further jobs will go immediately after that. So we are seeing job losses already, and we anticipate more. I've got probably a final question here from Magali Karate from ODI. Do you have any recommendations on how to do financial planning based on an estimated 20% reduction in the workforce at any one time?
I mean, yes. The one thing I would say there is if you're applying a blanket 20% reduction in workforce, then obviously your salary and your salary related costs will drop by about that amount. That reduces your costs. What I would immediately say here is that approach is too broad and will likely result in a not very useful forecast, because a 20% reduction in staff will almost certainly impact your income side in at least the month to follow as well. It will be completely illusionary for me. I'm not sure how you see that, Joseph, but if I hear 20% staff cut down with the same ongoing income going in for the next few quarters, that doesn't add up to me. So I would really encourage anybody to not think in percentages, but say which programs are actually doing well, where we need to invest, and which programs are very affected by this locked down by this crisis, because they are the ones will likely be less resilient to future shocks as well. There we can make more targeted reductions, be it in staff or be it in other costs, because that will have less of an effect of our income line. So anything to add there?
No, I think you're, you know, if you're able to reduce staff by 20% in any sort of term and maintain income, for example, then you might want to start asking what those people were doing. So yeah, I think you can, you know, there are, if we're talking about flexibility in the workforce for perhaps a new way of working, I don't know if we're on some sort of shift basis and things might flex like that. That could be different. Or if we're looking at planning for sort of waves of sickness, you know, that are equivalent to 20% of the workforce during this kind of crisis, I think there are possibilities to make those calculations. But I guess if you were doing it as a kind of long-term scenario, you would want to think about the income implications that go with that, or even the output implications. Like, what are you not delivering that you once were, and you know, and what impact is that going to have?
Good.
Thanks, Joe. And I think there we'll wrap it up. We're working with Joe and Chris from MzN with another set of webinars coming up. So please do look out for those. The slides from this presentation we've made available to you, but if you've got any further questions after the webinar, please do get in touch with us, get in touch with Chris or Joe, and you know, Bond's here to help, so please do get in touch with us and let us know what you need from us, and we'll try and provide it. So thank you very much for taking the time to attend, and thanks again to Joe and Chris from MzN.
Really appreciate it. Thank you very much, everybody, and stay healthy.
Thank you very much.